the muscle testing because we're doing that on the first practical. So that's when we will include the grading for that. We'll give you the strength numbers so that you can make the decision on what device you'll use. You'll come in, you'll do your intro, talk about we're going to do gait training today, makes you more independent. You know, you could get dizzy coming up the stand, but I really want you to do this because it is oh so good. And then you will size the device. Will be the first component, and then after you size the device, you will teach the gait pattern, which will go over.
Okay, you ready? How tall are you, Nicole?
Let's say her left foot's out, so let's say her left side is affected.
Okay. Okay.
We'll say she's 50% weight bearing, so she can put her foot down.
15 or 50?
50.
Okay. 5, 5. Okay. Someone have you stand up. Okay, I'm gonna be holding her up. Nice job. All right.
So how do we want to teach her to come up the stand?
Hold the crutches.
So she should be holding the crutches on her unaffected side. And then we might not have done it this way, but ideally you would be on her affected side.
Oh, okay.
So, so that way the crutches are on one side and then you are on the other side.
Okay. And then use this handrail and push yourself up. Good. Nice job. How are you doing? Good. Good. Okay. So you're going to put one of these under your right. Good. And then put this on there too. Okay. And then bring this crutch. Bring your feet together. If you can. Can you step forward for a second? Okay. And then you're going to bring the crutches forward 4 inches. And then bring them in a little bit. A little bit more. Good. How do you feel? Good. All right, you're about good right here. I may adjust the handle rails just a little bit. So I'm gonna look at this side. Looks good. I'm just gonna have you.
So you think the height of the device is good, but you want to bring up the arm rails, correct? What do we think looking from a distance?
Higher. Needs to go higher.
Yeah, so if I come over, go ahead and stand up nice and tall, Nicole.
Oh,
I can get my whole
Yeah.
hand in here. So again, making sure your patients are standing all the way up, but even when she was slouched a little bit, I could tell those are too short. So I would think about going up 2 notches with the height.
Oh, 3
Yeah.
notches, because it said 5'5", but when I did it was 5'8".
Okay, okay, just.
So again, you got it set to the ballpark guesstimate, but it does not work that way for all.
Yeah, I think because she's slouching, maybe, I don't know.
Oh.
Good.
Oh.
Go ahead.
Okay, so now, how about when she brought her up to stand? Did that look ideal? Yeah, so you're gonna come back to your patient's affected side. You wanna be back here. So you were kind of like through her armpit. That just didn't look comfortable for either of you. So you'll be here for sitting and for standing, and you can have her pass the device back to her.
But I'm standing on her affected side.
You wanna stand on her affected side. So don't go around back, go around front. So do what you did before. You did the transition fine. You went, so underhand grip, very good. Now you can have her pass the device
Okay.
to the right.
Right, please.
Other way.
You're on the affected, the device is on her unaffected, and then you can have her sit. And then just for time's sake, I will help you and we'll bring up
Thank you.
the device 2 notches.
We put on 5 8
5 and 8, okay.
Mhm.
So we're gonna go up 3.
That's right here.
And then you can pass the devices back over here. Go ahead, get a nice grip on the back of the.
Underhand grip? Okay. You're ready to stand up. Nice. And then you can pass
And then have her pass the device.
and stand up back.
And then a little bit forward to get in user position. Does that look better? Go ahead, try and get 2 fingers under. Should be nice and snug.
Very snug.
Very snug. And then what do we think about elbow flexion?
Good. I think it looks good.
Looks better.
Yeah, I would say you might even be able to go down 1 with the handles. If you kept it there, I don't think I would take points off, but I think down 1 would. So let's go ahead and let's say you're non-weight bearing now. Go ahead and take some steps. When you are gait training with your patient, you're gonna stay posterior lateral. 1 hand is gonna be on the front of her shoulder, and then I am trying to step with my patient here.
Speedy.
How does that feel? Her shoulders are shrugged up a little bit higher now than they were, so the elbows look a little bit more extended. So that height might be okay, or if we bring them down 1, it might actually avoid her shrugging her shoulders. Clinically, I will change the height of devices all the time, and then I won't see the change that I wanted, and I will change it back to where I was before. So it is okay on the practical if you think you have the height that you liked, and then when you actually start gait training, you don't like it, you can change it. Obviously, don't change it in the middle of standing like we're doing right now. You would have your patient sit back down. But sometimes what you think the ideal height is doesn't look the same when they actually are doing their gait training. So we are both 3 down now. Let's try this again. I want to be on this side. And let's go ahead and begin. Does that feel better or worse? Let's see.
It feels better. I
So
think.
it feels better. So again, we're not at all stepping.
You're on the affected side?
You're,
My left is unaffected. No, he told me to be. He
No.
told me to
Non-weight.
yeah, we totally mixed this up here, but her left was affected.
Yeah.
So you gotta lift the
You
leg.
gotta lift it.
Non-weight bearing, no weight,
Don't put weight on it.
non.
Let's try.
Like swinging it?
Initially, I said you were 50%, and then when we started walking, I said let's. Okay, so lift your left leg, and then you're gonna step.
Oh,
Remember, you want to. Remember, you want to swing the left leg forward first with your step, and then swing it back as your right leg comes through. Yeah. There we go. That's a little bit better.
Right. You swing through.
Yeah, you're non-weight bearing on your left, so it's not touching the ground, but you're walking on air. That's my personal cue that I made up. I did not steal it from anyone in this class.
It's a really good one, I like it.
It's a really good one,
Really
right?
good.
So I'm trying to step with her, so it's kind of like we're dancing here. And as you can see, she said she felt a little bit more comfortable. The elbows were flexed just a little bit too much, so that was causing her to hike her shoulder, and then she was straightening her elbows. She was here, and that didn't feel as comfortable. You get the elbow in a more comfortable position, and that's just gonna make it easier for her to use. Good job. And now you get to pick the next therapist.